So initially we're going to do a posture exam, and when you see the person sitting and standing, of course, one of the most common things that you'll see with folks with a frozen shoulder is that protracted shoulder. Now here we have our beautiful model Elenia, who is just here for the fun of it today, but she's going to be demonstrating the techniques with us. She does not have a frozen shoulder, but for the sake of the program, we're going to pretend that you do. So in someone who has the adhesive capsulitis, it's very common to see the scapula elevated and protracted. So you see that there's tight pec minor, tight pec major, tight anterior deltoid, contributing to pulling that shoulder forward, tight serratus anterior. So these are all areas that are predisposing factors to development of adhesive capsulitis. So one of the first things I like to do is get that posture back and down, get that scap more neutral so that the glenohumeral rhythm will be intact once again. How can we address the tension in the pec? Well, if you think about pec, comes from the midline of the sternum, attaches to the superior proximal humerus. So you have pectoralis major coming across the upper chest, pec minor from the upper ribs coming superior lateral, attaching to coracoid process here at the shoulder. And you'll see that there's some taut bands, especially if you open up the shoulder a little bit, which is the last thing that most of these people want to do, so just open a little bit. You can feel where the anterior axillary fold is, palpate in there, and you'll see there's usually some very taut bands of contracted fascial tissue. But rather than digging in right away, as many people do with their mobilization and direct stretching, I like to start with some of the superficial myofascial techniques. So just with the arm relaxed, I often rest them on my arm. If that's too uncomfortable, they can be in this position. I'll start with just some gentle skin glides. How much does a skin glide? Superior, inferior, medial, and lateral. And for many people with adhesive capsulitis, you're going to find the skin doesn't glide much at all. So check and see, is it bouncy at the end of the range of motion with a superior glide, inferior glide, lateral glide, medial glide? Notice here, even in this example, her lateral glide is a little bit limited. So if you use an adherometer or just a ruler, the transparent ruler on your goniometer, you can measure how many millimeters of skin glide limitation that they have. So check the skin glide in this case, and for many people, the superior lateral motion, or if you're looking at the face of a clock, it would be moving towards, say, 2 o'clock. The superior lateral motion is the most limited. And I check across the whole upper quadrant to see, is the skin tight anywhere? I'm showing you the most common restrictions that we find, and that is lateral glide is typically most restricted, and especially superior lateral glide more restricted in someone with the protracted shoulder and adhesive capsulitis related to that postural dysfunction. So skin gliding, take up the slack and hold in any direction that it's most tight. So here it's tight moving towards, say, 2 o'clock. Let the arm be in a relaxed neutral position at first so that it's not too uncomfortable. Because as you know, people with a frozen shoulder will be complaining as soon as you start trying to open that arm up, right? So just keep it at a neutral, comfortable position. And in gliding, you could use the body weight as the counterforce, or you can use your opposite hand. So if I'm thinking, what muscles attach here? You have coming in biceps tendon, anterior deltoid, pectoralis major, pectoralis minor. So most of these are going in that same direction as that 2 o'clock or superior lateral restriction. So I will pin down or anchor down those tendons, and with my other hand go from insertion to origin. So I'm just going to place the hand on the chest here, okay? So between the sternum, you do just a stretch across from origin to insertion of the pec and hold. Now if you go very lightly, you're working mostly on the skin. But you know the skin through its fascias attaches to all the deeper tissues. So of course, be aware of that. Take up the slack and hold. And unlike usual stretching where you might count to 30, you're going to wait until you feel the softening of the tissue, what we call the fascial release. It usually takes about 1.5 to 2 minutes. So you won't wait that long in our demo, but on real patients, say you were holding it and all of a sudden you just felt that soften, melt down, warm up, and release. Take it to a new level of stretch, hold again. So 2 or 3 little stretches or fascial releases in a row, come back and see how are the trigger points. Is the range of motion any different, particularly in abduction and horizontal abduction? You can see some differences right away, because even though you think you're gliding just the skin attaches directly to the muscles and the fascias that go deep. So you're influencing everything layer by layer. Sometimes I like to do a little bit of skin rolling. And that can be very pinchy if someone's tight. So in skin rolling, we're just lifting up, and you want to get a little close up on this. Lifting up the skin with the thumbs and the fingers and rolling it. And you can roll in different directions. I like to go anything, it's like a massage technique. I'll typically go toward the heart to start. And just see, does the skin lift up? Again, if you find folks that are having that adhesive capsulitis, you're going to see that the skin does not lift up well. And hers lifts up quite nicely. She has a healthy shoulder. And it won't roll well. So you want to get a grip. Don't dig your nails in and don't try to grip too hard. Just enough of a grip. Wide grip. Get a little pinch of tissue. And then glide with the thumbs as you feed the tissue with the fingers. And that starts to get some nice blood flow into the shoulder, and it starts to mobilize some of the superficial fascias in the area to loosen things up. That's especially effective if people have had post-surgical scarring or post-traumatic scarring in the area. The skin rolling and gliding is especially nice to work on the scar tissue. So that's our beginning technique as a warm-up.